But before I talk about humerus bone, I want to say this: for learning about osteology of any bones, we remember some points. These are the introduction, anatomical position, site determination, bony landmark, attachments, ossification, and clinical anatomy of the any bone. When it comes at exam about osteology of the any bone, then we must write those points. Now let's talking about humerus. In this video, we learning about introduction, anatomical position, site determination, bony landmark, or the features of the humerus. The humerus is the bone of the arm. This part of the human body is called the arm, and this is the humerus bone, and it is the longest bone of the upper limb. It has an upper end, a lower end, and a shaft. This is the anterior view of the humerus bone, and this is the posterior view. This is the upper end, this is the lower end, and this is the shaft of the humerus. Now talking about the anatomical position of the humerus. The humerus is a long bone located in the upper arm between the shoulder joint and the elbow joint. The proximal humerus connects to the shoulder through the glenoid fossa of the scapula, forming glenohumeral joint, and the distal humerus articulates at the elbow to the radius and ulna in the forearm. Next is the site determination. The upper end is rounded to form the head. The lower end is expanded from side to side and flattened from before backwards. The head is directed medially, upwards, and backwards. The lesser tubercle projects from the front of the upper end and is limited laterally by the intertubercular sulcus or bicipital groove. Now talking about the features of the humerus with bony landmarks. At first, the upper end. This is the anterior view of the upper end of the humerus. The head is directed medially, backwards and upwards. It articulates with the glenoid cavity of the scapula to form the shoulder joint. The head forms about 1/3 of a spear and is much larger than the glenoid cavity. The head of the humerus is much larger than the glenoid cavity. Next is the line separating the head from the rest of the upper end is called the anatomical neck. In this slide, the yellow line is the anatomical neck of the humerus. Next, the lesser tubercle is an elevation on the anterior aspect of the upper end. Okay. The greater tubercle is an elevation that forms the lateral part of the upper end. Its posterior aspect is marked by 3 impressions: upper, middle, and lower. Lesser tubercle and greater tubercle both are the bony landmark of the humerus. This is the intertubercular sulcus or bicipital groove which separates the lesser tubercle and lesser tubercle medially from the anterior part of the greater tubercle. The sulcus has medial and lateral lips that represent downward prolongations of the lesser and greater tubercles. This is the medial lip and this is the lateral lip of the intertubercular sulcus. The narrow line separating the upper end of the humerus from the shaft is called the surgical neck. In this slide, red color line is the surgical neck of the humerus. And a morphological neck lies 0.5 cm above surgical neck. Above surgical neck, it shows the position of the epiphyseal line. This is the posterior view of the humerus. This is the right humerus bone because the head is directed medially this side and the greater and lesser tubercle is in front or anterior aspect. Okay, so this is the right humerus bone. The posterior aspect of the greater tubercle is marked by three impressions: upper, middle and lower. Next is the shaft of the humerus. The shaft is rounded in the upper half and triangular in the lower half. It has three borders: anterior border, medial border and lateral border. The upper 1/3 of the anterior border forms the lateral lip of the intertubercular sulcus, and the middle and its middle part forms the anterior margin of the deltoid tuberosity. Anterior margin of the deltoid tuberosity. The lower half of the anterior border is smooth and rounded. The lower half of the anterior border smooth and rounded. The lateral border is prominent only at the lower end, where it forms the lateral supracondylar ridge. In the upper part, it is barely traceable up to the posterior surface of the greater tubercle. In the middle part, it is interrupted. It is interrupted by the radial or spiral groove, where the radial nerve is passed. Next is the medial border of the shaft. The upper part of the medial border forms the medial lip of the intertubercular sulcus. About its middle, it presents a rough strip. It is continuous below with the medial condylar ridge. Medial condylar ridge. Medial border of the posterior aspect. This is the medial supracondylar ridge. The shaft has three surfaces: anterolateral surface, anteromedial surface, and the posterior surface. The anterolateral surface lies between the anterior and lateral borders. The upper half of this surface is covered by the deltoid. A little above the middle, it is marked by a V-shaped deltoid tuberosity. Of the anterolateral surface, here present the deltoid tuberosity. It is V-shaped tuberosity where the all fibers of deltoid muscle are attached. All the fibers of deltoid muscle are attached to the shaft of the humerus. Next is the anteromedial surface. The anteromedial surface lies between the anterior and medial borders. Anterior and medial borders. Its upper one-third is narrow. And forms the floor of the intertubercular sulcus. A nutrient foramen is seen near the medial border below its medial part. Below its middle part, a nutrient foramen is seen near the middle part, okay? Near the medial border. Next is the posterior surface. The posterior surface lies between the medial and lateral border. Its upper part is marked by an oblique ridge. The medial one-third is crossed by radial groove. This is the radial groove. Next is the lower end of the humerus. This is the anterior view and this is the posterior view of the lower end of the humerus. The lower end of the humerus forms the condyle, which is expanded from side to side. And non-articular parts, and it has articular and non-articular parts. The articular part includes the following: the capitulum. The capitulum is a rounded projection which articulates with the head of the radius. Rounded projection. This is the trochlear. It is a pulley-shaped surface. It articulates with the trochlear notch of the ulna. The medial edge, this is the medial edge of the trochlea, projects down 6 mm more than the lateral edge. This is the medial edge and this is the lateral edge of the trochlea. This results in the formation of the carrying angle. About the non-articular part of the lower end of the humerus. The medial epicondyle here and the lateral epicondyle. The lateral supracondylar ridge and the medial supracondylar ridge. The medial epicondyle is a prominent bony projection on the medial side of the lower end. It is subcutaneous and is easily felt on the medial side of the elbow. It is easily felt on the medial side of the elbow. The lateral epicondyle is smaller than the medial epicondyle. Its anterolateral part has a muscular impression. Its anterolateral part has a muscular impression. Next is the sharp lateral margin just above the lower end is called lateral supracondylar ridge. The medial supracondylar ridge is a similar ridge on the medial side. The coronoid fossa. This is the coronoid fossa. The coronoid fossa is a depression just above the anterior aspect of the trochlea. Just above the anterior aspect of the trochlea. It accommodates the coronoid process of the ulna when the elbow is flexed. This is the radial fossa. The radial fossa is a depression present just above the anterior aspect of the capitulum. Anterior aspect of the capitulum. It accommodates the head of the radius when the elbow is flexed. The coronoid fossa accommodates the coronoid process of the ulna when the elbow is flexed, and the radial fossa accommodates the head of the radius when the elbow is flexed. Next is the Olecranon Fossa. This is the Olecranon Fossa, which lies just above the posterior aspect of the trochlea. The Olecranon Fossa lies just above the posterior aspect of the, this is the posterior view, posterior aspect of the trochlea. This is the trochlea, posterior aspect of the trochlea. This is the Olecranon Fossa. It accommodates the olecranon process of the ulna when the elbow is extended. Now we discuss the quick revise of the bony features or bony landmark of the humerus. This is the anterior aspect and this is the posterior aspect of the humerus. This is the head, which is directed medially upwards and downwards. This is the greater tubercle and this is the lesser tubercle. Greater tubercle and lesser tubercle always present at the anterior aspect of the humerus. Okay, this is the intertubercle sulcus, which is present between the greater tubercle and lesser tubercle. Below, this is the deltoid tuberosity, which is V-shaped. Now, below the deltoid tuberosity, at the lateral side, this is the lateral supracondylar ridge and this is the medial supracondylar ridge at the medial side. This is the coronoid fossa and this is the radial fossa. Coronoid fossa just above the trochlea, okay, and radial fossa is present just above the capitulum. This is the lateral epicondyle and this is the medial epicondyle. This is the anterior aspect. By bony features or bony landmark, we identify the anterior and posterior part or aspect of the any bone. Okay, and identify also the side, which side is the bone, or right side or left side. Now this is the posterior aspect of the humerus. The posterior aspect, this is the posterior surface of the greater tubercle. The greater tubercle has three impression: upper, medial and lateral. This is the surgical neck and this is the anatomical neck. Okay, this is the shaft and this is the lateral supracondylar ridge and the medial supracondylar ridge, and this is the Olecranon Fossa, just above the posterior aspect of the trochlea. Posterior aspect of the trochlea. This is the lateral epicondyle and this is the medial epicondyle. Quick revision. These points are always remember when write about humerus. The upper end, at the upper end there present the anatomical neck, lesser tubercle, greater tubercle, intertubercular circles, surgical neck, morphological neck or epiphyseal line. At the shaft, the upper half of the shaft is round and the lower half of the shaft is the triangular shape. Okay. Three borders and three surfaces: anterior, lateral, medial border, and anterior lateral surface, anterior medial surface, and posterior surface. At the lower end, there present articular part and non-articular part. Articular part is the capitulum and the trochlea. Capitulum articulates with the radius and trochlea articulates with the ulna. Non-articular part: medial epicondyle, lateral epicondyle, lateral supracondylar ridge, medial supracondylar ridge, coronoid fossa, radial fossa and olecranon fossa.